It's going to be July 23rd. You don't have to figure out where you're going. It's going to be in the same place for today. July 23rd, and the speaker is going to be talking about estate planning. And then our next coffee talk is July 8th in Mountainburg, and that's usually a really good turnout. And our very own Ashley is doing the presentation. She's going to be talking about staying active. So if you forget all that, no worries, just check our Facebook page. We keep everything really updated on our Facebook page. The big thing I wanted to talk to you about is our conference. It's coming up September 11th and 12th. It's at the same place because they were so generous with us last year at First United Methodist Church downtown. In their big, huge, they have a big, huge family room. We have excellent speakers. Again, I'm not sure how our conference committee pulls that off every year, but we do really have excellent speakers. And we are looking for sponsors. So on your table, you should have a sponsorship and conference packet, right? And so please check that out. There's lots of sponsorship opportunities. We give lots of opportunities for all of our vendors to talk to folks, and we're really going to be pushing not only for healthcare professionals, but for seniors and their caregivers in the community to come to this conference. So, what I want to do next is I want to introduce to you somebody very, very special. I don't know, maybe I might even cheer up. I'm going to cry maybe. So, Mandy I've known her for probably almost 20 years, maybe, at least 15. So I've known her since she was a baby therapist right out of school. She's a certified therapeutic recreation specialist. And we're really excited to have her talk today about navigating the experience and moving into memory care. So that's pretty scary with some people. So anyway, welcome Mandy.
Before I get started with the presentation, I want to bring out our dining services manager, Kendra. It's a sample of the good food that we have here, and I always love it, so I'm glad you guys can share it with us. Thank you, Kendra. Thank you, Kendra. I'm going to turn this down a little bit, because I don't more times than not, it's not the actual move, it's the emotional part of it that we're navigating, not only with the person coming into our care, but the families as well. We're going to discuss and share tips for supporting the successful movement experience and how to advocate for your loved one during the process. So how do you know when it's the right time to seek a more supportive environment? There are some different signs or changes that may occur that could be an indicator to explore more options for more support to both the individual living with dementia and you as a care partner. So first we want to kind of highlight what it is, what is memory care when you hear that. Memory care is a specialized care for people living with challenges of Alzheimer's and other forms of dementia. And when I bring that up, I know most of you probably already know this, but Alzheimer's, you kind of hear that, and you hear dementia, and you kind of wonder, what is the difference? Alzheimer's is dementia, but dementia is not necessarily Alzheimer's. So dementia, there are several different types. Alzheimer's is it's over half, I think, of the percentages of different types of dementias, which is why you hear the term Alzheimer's more often. But any type of cognitive impairment that would risk them being at home by themselves, then you can kind of look into memory care for their help. Person-centered programs are tailored to each person's interests, and it helps promote their independence and support their cognitive abilities. So some different signs to look for are changes with physical health, emotional or cognitive changes, and safety concerns. So we're going to look a little deeper in all of those areas. You may notice more or some of these changes with physical health, and they may be occurring more frequently or consistently. So things like losing weight due to potentially missed meals, and it's not that, oh, they're just not hungry, it's they get sometimes mixed up with the time of day, they don't realize that it's time for meals, or they're too preoccupied and busy wandering or going through things to recognize, hey, I need to eat. You might see some unexplained injuries. They can fall, bump into things, hurt themselves, but they're not always going to remember what they did. Now, granted, we get bruises and stuff on our arms, and we're like, what did I do? How did I do that? But if it's a big injury, we usually will know what happened. If they don't, that's kind of a flag. Changes in self-care or poor personal hygiene with body odor, bad breath, nail care, just kind of those daily tasks of not being able to take care of themselves. Wearing the same clothes over and over, or wearing unclean clothes. They may forget that, oh, this is my dirty clothes basket, or this is my clean clothes, and they get that switched up. Lethargic or physical changes from not taking medication properly. So if they're still in charge of their own medications, and if they have a confusion of what time of day it is, they think it's morning and not night, or vice versa, they may be taking those medications inappropriately. And then frequent urinary tract infections due to dehydration and poor hygiene. So that's something that pops up a lot. Now, as a side note, just as something that you kind of learn, especially in the psych field, UTIs can cause confusion in anybody that's an elderly age. So just because someone is confused and acting differently, or even showing signs of psychosis, doesn't mean that they have dementia right away, especially if it's sudden onset. But if it it can exacerbate it. If you do have dementia or mild dementia, all of a sudden they might seem a lot more progressed. If you get the UTI under control, then they kind of return back to their baseline. But I kind of do that from personal experience with my grandma. We went through several rounds of that. She has dementia, no she doesn't, she does. She got the UTI, and then she got confused again. And it was really hard to know, whether she really had dementia or not, especially when you're in those first stages. But I like to kind of educate people on that, because I had to do a lot of research then to figure that out. So you may begin to see some cognitive or emotional changes with the individual living with dementia. More confusion phones or other familiar tasks, especially nowadays with the smartphones. I have problems every time that it updates trying to figure out how to work it. So, but we can usually navigate and figure things out. When they're set in a certain way, it's a lot harder to kind of adapt with those changes. Even the flip phones. I noticed a lot of my memory care residents do have a flip phone, but they don't remember how to even do the speed dial or what to do to get to their loved one. And there's times where they can use it fine, and then you can tell later in the day when the brain gets tired, they really struggle with that task. Self-isolating or not participating in activities that brought joy in the past. Similar to depression, when people experience that, they kind of seem to isolate and not do the things that they enjoy. If they have a hobby that requires, prioritizing and sequencing things, when you lose that ability to sequence and put things in order, now it just becomes challenging and frustrating. So that's why you see a lot of people pull away from things that they used to enjoy, even if it's like crocheting or blanket or something. They might be able to do the simple crochet, but following a pattern would be really difficult. And that's kind of a difference in the scene. Sad, just kind of overall appearing more sad. Sleeping more is a big one. Now granted, as people get older, they do tend to nap more and need those little breaks, but if it's someone staying in bed all day, maybe only getting up to use the bathroom or eat, if even, then that's kind of a sign as well. You might notice changes in personality, such as being fearful, suspicious, or agitated, and that could be even with the closest loved one. If you're a power of attorney or the person who maybe a caregiver that lives with them, you may be their child, and all of a sudden they're suspicious that you're stealing their money or you're taking things from them, and it's really that you're trying to help them, make safe decisions, but they get that paranoia that kind of comes along with it. No longer keeping their social visits, forgetting appointments, that's a big one too. Increased phone calls to family with repeat questions and that need of reassurance. So it might be calling you over and over at 10 o'clock at night, midnight, 2 o'clock. Do I still have that appointment in the morning? What is it for again? Who's coming over at this time? So just that confusion. Calling 911 frequently. So that can happen often. For a variety of different reasons, and then their poor judgment or decision-making abilities. So those are all kind of your cognitive and emotional changes. Person safety and environmental red flags. There's some important things to be aware of. It could be signs that more supportive environment is needed for their safety and their well-being. Especially if they're missing medications or they're not getting refills in a timely manner. I'm sure you guys all know, obviously if you skip medications, it's a problem. And especially if you have some type of psychiatric medications, it's not good to just stop those suddenly. So you want to make sure that they're not missing their medications. Forgetting to turn off their stove or overcooking things in the microwave. Yes, we all make mistakes and we might put something in the microwave that's not appropriate, but when they're putting metal utensils in there and starting a fire in it, that's probably a good red flag. Improper use of appliances, such as putting clothes in the oven instead of the washing machine. Getting lost while going for a walk or driving, that's probably one of the biggest ones I hear about a lot. They go out, they go to the grocery store, then they try to get home and they can't find their way back. Or it takes them 2 hours to get home when it should take 15 minutes. That's usually a pretty big sign. More disorientation with time of day or getting up in the middle of the night to go outside. Like they're thinking, I'm going to go outside for a walk, and it's 1 o'clock in the morning. And you hear the term sundowning a lot. Sundowning is typically meaning those behaviors that you kind of see more when the sun goes down. So in that evening time, the brain is really tired, especially with the more advanced dementia it gets, your brain brain is having to work overtime trying to remember everything that you're supposed to, things that we take for granted each day that come natural. So when that brain gets tired, then things get kind of more confused and it's harder to even sequence things. Now, sundowning does not always mean that it's going to happen like summertime now. It's not going to happen at 9 o'clock. It could happen at 6, it could happen at 4, it could even happen at 1. Or it can happen at 10 a.m. if it's a very cloudy morning and it's storming outside and it's dark. Because their mind thinks that it's dark and it gets really confusing of what time of day it is. So I see a lot of those behaviors pop up on those stormy days. That really does kind of have an effect on them. Other red flags: expired food or improper storage of food, putting the milk in the cupboard instead of in the refrigerator, things like that. You might notice a lot of sticky notes throughout the house, in the car, all over things for reminders. Excessive clutter in the home, unopened mail or packages. They bring it in, they set it down, they forget about it. So missed bills kind of goes along with that as well. So either you go financial problems, bills not being paid, or money missing from the bank account. Also, you're going to have a lot more issues with scamming calls because they're not going to be able to decipher this person is really just trying to target me to get my money. They're just going to fall for it, hook, line, and sinker. So if they're giving large amounts of money to various people, that might be something to really look into. And then you might also get increased phone calls from neighbors with concerns. So maybe their neighbors or friends are calling you going, hey, there's something wrong with my friend so-and-so. I'm noticing these changes. If you're getting a lot of those calls, that's a good time to kind of look for some extra help. So it is okay to talk about the reality of caregiving. It's not an easy job for anyone. So when we say caregivers, yes, we have caregivers that are in a community or a facility, but also your family, as a family member, POA, guardian, things like that. There's a lot of caretaking that goes into. There's a lot of people that go into that job. We'll put it that way. So even if your loved one is in a community or a facility, it doesn't mean that the person, their loved one, is not still being a caregiver, because you're still having to give a lot of support. So caregiver stress may also be an indicator that it is time to seek support of the memory care community. We have, memory care has a team of skilled professionals in Alzheimer's and other dementias. They also go through specific training repeatedly throughout the year, so we kind of stay up with that. And that kind of helps us provide that support that they need. As a caregiver, you want to ensure that your loved one gets the best possible care and support, but you also have to take care of yourself. I'm sure you've heard it many times, you can't pour from an empty cup. And when you're feeling exhausted, irritable, even resentful of your loved one, and you're thinking, I would never be that way, I would never resent my own mom or something, it's going to happen if you're burnt out. And that's just the reality of being a caregiver. So if you're experiencing those signs of stress, it's a good time to get some support. While there's no single test that will determine if anyone has dementia, physicians and other specialists such as neurologists, psychiatrists, and geriatricians are well equipped to make the diagnosis. They'll use a combination of information from medical and personal history, physical exams, and cognitive functioning tests to support their diagnosis. Ongoing, open, and honest conversations with the physician team will help guide the need for the new level of care. So the biggest thing is be honest. We tend to downplay it a little bit because we're thinking, mom's not that bad, or we try to give excuses for things, and it's just natural because we know how our loved one was, and we don't always want to accept that change. conversation in memory care with a loved one can be a very challenging one. The approach and considerations of the discussion require strategy. It is important that the communication includes patience, understanding, and good listening skills. Sometimes we just want to say all the things, but sometimes we just need to stop and listen to what they're feeling, what their emotions are, and kind of come at it more answering the emotional part. So planning is key when you're preparing for that initial conversation. Again, kind of like I said, you want to focus on that well-being, individualize the approach and what is communicated at one time based on where they are in the disease process. You know, it's a lot harder for someone who's maybe in those mild stages because they're still kind of getting around and doing things okay. They can still have a conversation. That's also when they're going to be in the biggest denial state because they think everything's still fine. So you might have a lot of pushback in that mild stage. In my own personal experience, I tend to see people move to memory care when they're closer to that moderate and maybe even advanced stage. And in a way, we can still help them, but there's times where I really wish that we got them at an earlier stage. One, so I get to know them better and I can individualize their programs more tailored to what they need. But also we can have that intervention earlier and help that help the disease process not come out so quickly, if that makes sense. So we want to listen and validate their emotions with empathy. Explore potential fear of the unknown. That's going to be a big one. Or anxiety with leaving a familiar environment. Be mindful of your own body language because they can get very frustrated or very angry even with you. They may even blame you for, oh, you just want to put me in there so you can take all my money or you can sell my house and get all my things, right? And so you can reason with them to a point. If it's going to cause them to get more angry, then reasoning is not really a place we want to be. We often, with dementia, we tend to want to bring them into our reality, but their brain is not able to do that. So we need to be in their reality and kind of approach them from that. So highlight the good things, highlight the positives about it. You know, you're going to be around other people every day instead of stuck at home by yourself. You're going to have activities to go to. You're going to get to go on outings. You're not going to have to worry about driving there and finding your way back home. You know, you don't have to, I mean, my residents, they get excited. I don't have to even cook anymore. I don't have to clean my dishes. I don't have to, you know, clean my room because we have housekeeping. It's all done for me. They love that. And so that's kind of that positive aspect of, you know, we're giving you a better quality of life. And that's kind of a good way that you can kind of focus on what are the positives, what's going to help them the most. So some more things to think about. Just consider the best time and location. When you're working with someone with dementia, kind of what I talked about earlier with the sundowning, that's typically going to be in the afternoon, evening hours. The best time to have a good conversation with someone with dementia is in the late morning or mid-morning time frames. That's when their brain is the most rested, assuming that they were sleeping okay through the night. But they're more rested, they're more alert, and they're going to have a lot better ability to have that conversation. So I tell that for anybody, for any time. That's why Brookdale's really big about doing our morning cognitive exercises at that time, because that's when they're going to be able to do it the most, and they're not going to get as frustrated of trying to figure out any type of cognitive trivia, things like that. A comfortable environment where your loved one feels safe and calm, which is probably be their own home environment, but you don't want to do it like in a doctor's office or a random place that they don't have that comfort around them. Choose a setting that's free from distractions. Now, I know a lot of us like to have background music on, TV on in the background, things like that, but we're able to filter that out. You know, we can kind of focus on what we need to. When you have dementia, it's a lot like, it's kind of like a younger kid that can't find where they want to focus. And so it's really hard to hear if somebody's trying to explain to you if there's a TV back behind you or maybe a loud fan on your side, things like that. So try to take away any distractions. It might even be like closing blinds, because if there's people walking by or dogs or squirrels in the yard, they're going to be focusing on all the little things. So just kind of watch for distractions. Talk to other family members or trusted friends that can kind of help support you when you're supporting your family member. Don't try to go at it alone. Look into the Alzheimer's Association. Louise, where are you at in here? Louise is a really good resource for the Alzheimer's Association. There's lots of free resources out there that you can get from their website, and also just being a part of their monthly local support meetings. I can't say that enough. Being in a support group with other people that are going through a like issue that you are can help you in more ways than you'll ever know, especially with the emotional process. And then plan for more than just one conversation, because it's going to come up more times than not. It'll come up over and over again. So again, preparation is key for a difficult conversation. We want to plan it to be, personal. You don't want to sound very clinical or like I'm telling you you have to do this. You want to show that you're very concerned about them. So concerned about their safety, concerned about their well-being. I had to have that same discussion with my grandmother when she moved into a nursing home. And, her generation was, they brought in their moms, their dads, they cared for them until they passed away. But what I was seeing when she was living with my mom, I was like, you're at home by yourself all day. I know you're depressed because you don't get out, you don't get to do things. And then when my mom and dad come home, they're talking about work, which you don't really know day to day what they're doing, and it's nothing personal to you. But I was like, if you're in a community with other people that are around your age that have also lost their loved one, their spouse, they've been through that grief, they've lost some friends, they maybe have some of the same hobbies that you do. There's so many benefits from being social and around other people that you can have conversations with that you can't really with your own daughter and son. It's not the same. And, kind of bringing it from that perspective helped her kind of open her mind to do that. And I tell you, she was thriving after that because she really missed that social aspect of things. If they'll have a roommate, a partner, you want to partner with the community team for that transition, maybe introductions prior to move-in, maybe invite them in to have lunch with this person, just to kind of interact beforehand so we're not just throwing them into a room with somebody and then making them figure it out. As you know, with dementia, there's a lot less impulse control of things that are said and done. So it's good to have those little interactions before and make sure that everything works out okay. You want to be truthful with your loved one. Don't try to, hide things or say, oh, well, we're only going to go for a week and then you'll get to come back home. You don't want to give them that false hope. Now, sometimes we might say they might be coming in for some rehab for a while, but we don't know how long it's going to be. Kind of presenting it maybe like that kind of helps with that transition to get them started. Don't be afraid to tell them why, because they're not going to remember, but when you're pointing out some of the things they've done to put themselves at harm, like leaving the stove on, or starting a fire in the kitchen, going out and wandering down the sidewalk at 2 a.m. and not being able to find their way back home, locking themselves out of their house for a day or two. Things like that are some big things to bring up and to explain why you're concerned about their safety. Reassure them repeatedly. Make sure you visit with them when that does happen so they don't feel like you're just kind of thrown in. And even having a calendar with days marked that you'll visit kind of helps them know, that you are coming back. Again, that you're not just kind of abandoning them. And then plan for multiple repeat conversations. They will probably ask that same question over and over. Our tendency when we have to repeat ourselves, we kind of start to get a little short and abrupt and irritated. Try to answer it like you did the first time. You know, remember that they're not forgetting it on purpose. They're not trying to ask you to get a different answer. They just simply can't retain what it is that you said the first time. Okay, now that we realize it would be beneficial, and the time is right to move into memory care, how do we navigate that emotional journey? It can be fraught with emotional challenges from feelings of guilt to uncertainty and fear. Understanding the various emotional aspects will help in understanding and navigating the journey for you and the person living with dementia. You might want to be aware of different emotions that may be experienced. This could be anything from confusion, fear, anger, grief, anything like grief. But if they're having to move out of the house they live in for the past 52 years into a different community, they're going to grieve that loss. That is a loss to them. And it may be that your parents are still married and they're having to be separated. That could be a realistic thing too. There's a lot of things that they will have to adjust from, so that grief can be real even if they can't comprehend that that's what the emotion is. They may feel that helplessness and that hopefully they're going to get more to the resilience part and the acceptance. When you start to see them thrive and enjoy some of the activities, they start to come out of the room more. I get to see them kind of light up and get excited about things again. When they laugh, they smile. I love when I kind of see them come out of that shell. And I think that's something I hear more often from family than not, was if I would have known like how happy my mom or my dad would have been, I would have moved in here a long time ago. I hear that often. And I think again, it's the fear on our part that keeps us from getting that and accepting that help. So again, being prepared as possible to support your loved one, to listen and understand their emotions and what they're feeling. Obviously, we're going to look for a lot of those nonverbal communication cues. Allow them to express their emotions openly, even if that anger is on you. That's a hard one. Step out of the room if you need to. Take a break. You may just decide this is not a good day to visit. I may need to step out for a while and come back tomorrow. And tomorrow could be a totally different day. So just kind of keep that in mind. Sometimes we're just not going to have the conversation when we want to. We want to make sure that it's when they're ready. Validate their feelings without resistance or judgment, and then give reassurance. Okay, that's always important. So our potential emotions as a caregiver, if you notice, it's almost the same. There's a lot of things that overlap with a person with dementia as well. So that being said, I feel like guilt comes in a lot, because when we do want to get that help, then we feel guilty that we're not the one providing that care, or I wasn't able to keep my mom at home, and I feel guilty for that. That's a real emotion that comes up, which again is kind of what I was saying, being in a support group like the Alzheimer's Association groups, things like that is really helpful, because just being able to hear somebody else going through that same emotional process from your point of view really helps. You're going to meet people that have been through the process or going through the process or even thinking about it. You're going to have all the different stages, and they'll be able to allow that help. Give yourself permission to feel the varying emotions. It's okay to feel sadness, disappointment, or even anxiousness. You're going to have to process these as well. If you notice that you're getting frustrated and anxious while you're talking to your loved one, maybe you need to take a time out for yourself and kind of rejuvenate in a way and be ready emotionally for you to have that conversation with them. And it's okay too to ask the staff that are there to maybe help you through that, or ask if maybe somebody that's had a really good rapport with them from the beginning to maybe sit in with you, because sometimes they can our tendency is we want to go, oh, I'm going to move mom in here, we're going to redecorate this whole thing. I'm going to buy her a new bedspread and do this and that, and I'm going to decorate it all pretty. If it's all new things, they're not going to recognize it. So stick with what they like, what their favorites are, and decorate it like that. Make it feel like home. That's the biggest thing. Limit that bulky furniture just for fall risks, like coffee tables, ottomans, things that they can trip over. Especially if it's a smaller room, those are kind of some things to look at. Share as much as your loved one's personal and life story information ahead of time with the team. That way, again, they will know more about that person, more about your loved one, and be able to treat them not as a patient, but as an actual family member. And that's what we really try to do. Get to know your care team as well. You know who's going to be helping them. And then partner up with them for some ideas on the move-in, how to make it more comfortable for them. You might have them come in, meet everybody, then they can go to lunch in the lunchroom. And while they're eating lunch, you could be setting some things up in their room. I say it's always better to kind of have it prepared and ready for them when you bring them in. That way you're not doing that with them in the room, because that's just kind of very chaotic and stressful, and they're seeing you move around all their stuff. It can be causing a lot more confusion and stress. I'm just going to kind of briefly go over these, but just kind of try not to overwhelm your loved one. Be mindful if they feel like they're getting overstimulated. Again, hopefully you're not moving in by yourself. You've got some other family there. Maybe have them taken out for a walk or go to a nice sitting area where they can be comfortable while you're getting some other things put together for them. All right, how can you advocate after the move? We want to continue that. But advocating for your loved one is best. Yes, as a treatment team, we're going to know them from a clinical standpoint, and we're going to know them from an activity standpoint, but you are their loved one and you know them best. So definitely advocate. If you notice something's different about their behavior, you feel like something's worse, something's off from their normal, definitely bring it up and ask questions and advocate for any specialized care. Because as you know, people with dementia, they get illnesses just like we do. They just can't always verbalize of, hey, my throat hurts, or my knee is really bothering me, because they don't always have that ability to communicate what their needs are. We want to discuss with the community the best times or days to visit. If I have a resident that's a tendency to choke more during meal times, maybe visiting with them during their meals, not the best time to visit, or talking on the phone with them, because they'll have that tendency to kind of suck in their food. So I might say, wait till after lunch or before lunch, things like that. Or if I know, honestly, that they have really activities that they really love to do, or outings that they're really excited to go on, check with them and check with your care team too, so they don't miss out on that, or feel like they have to cut your visit short. We want to continue to listen to your loved one and validate their emotions, and anticipate that some days or moments may be harder than others. That can even come up with just anniversaries of things, and it may, again, they may not realize what day it is, but it could be that anniversary date or time of when their loved one passed away, or something along that line, that they might still be having a little more difficulty doing that. So like I said before, you are the voice for your loved one. Develop that partnership with the community and be open. Share your knowledge about your loved one, their preferences, their habits, their history, and also what they like to do. Because all of that really, really comes in handy when they are having some of those behavioral expressions and they're struggling. If you know what they like to do, we can use that as a tool to help them redirect some of that agitation and anger free to do so. And I hope this kind of enlightened you a little bit on memories.
Well, that was awesome. Good job. All right, so we have about 5 or 6 minutes left. And anybody in here that's new, it's not been to a meeting before? Welcome. And this is your first meeting?
Yeah, but I've been at the conference office.
Okay, well good, we're glad you're here. So we'll go ahead and start. Everybody can have the opportunity to tell about themselves, where they work, that kind of thing. Does anybody want to do that? Ashley, you get to go first.
I'm Ashley. I work at Chrissy Recap. The biggest thing I wanted to kind of address today is that we're setting up the next coffee talk, so I'm really interested to get information on volunteering for seniors. So if they'll know anybody or have any program that you have, I know 55 plus still a thing? Yes. Yes, they have volunteers that can help. I would love to see the seniors be more active and want to just give them options so they know there is more things in their community they can do. Even though they don't like stepping out of their boxes, but maybe we can encourage them to try. But Mercy Recap side, just want to let you guys know that we're another option for inpatient rehab. We would love to assist in any way we can. We're pretty flexible. If you have any concerns or if you have anything that you guys are wanting to try to tackle together, feel free to reach out. I would love to hear and love to maybe talk to a few things off with you guys. My phone number is 479